Hi, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, October 8th. I'm pleased to welcome you and to welcome Ed Brubaker, our Living Branches President and CEO, to our monthly conversation now.
Yeah, periodic, I guess we'll call it.
That's
I was
probably
just
better.
laughing the other day because I was seeing some older videos from last year, and I just got my hair cut again the other day. And when I look at my hair last year compared to this year, it's just kind of hilarious, actually.
It is evident that in those former videos or in those earlier videos, we did not have access to the hairdressers.
That's right, exactly. Yeah. And I think we made fun of Ben Roethlisberger and some other people along the way, too, in that regard. But yeah, what a year.
What a year. So, well, let's start with a COVID roundup where we are on our campuses. Actually, it's a little bit interesting right now because the only place that we have COVID right now is in our residential living residence. There's one person at Duckwoods and two people at Satterton who are testing positive.
Mm-hmm. And in some ways that probably makes sense too, in some ways, because those are the people that are more out and about in the wider community, just like you and I.
Yep.
So that logically makes sense. We really want to make sure, though, it does not come back into our care facilities because that is just more devastating to the residents, et cetera. But we'll talk later, too, about some changes in that regard as well.
Yeah. I guess we should mention booster shots because that has been by far the number one question that I'm getting from residents. When are they? Are they going to be at Living Branches? What is going on?
And the answer to that is yes. We are planning to do that in November. Lori Borglum and her team of people are working at the details. And so the dates will be coming out and be publicized soon. And we're looking at November. Part of the reason for that is we're targeting October for flu vaccine for staff and residents. And then November would be when we push the booster shot. So yes, that is coming. We're pleased with how that's coming together. We're working with two different pharmacies on that. And so it should be should be a good process, but that is scheduled for November, which is only a month away, by the way.
That sounds terrifying. I did have a conversation with Lori yesterday, I believe, finalizing those details. And so it will be coming out, the information will be coming out next week, and we will have clinics for all residents and all staff. So anybody who is a resident or staff person will be able to get it. Although I know some people, resident-wise, are already heading to their pharmacies.
Yeah,
so.
And I know some staff have already as well. So,
yep.
And that's perfectly fine, but we will have our own opportunities as well.
And I suppose we should take this opportunity to mention again the importance of being vaccinated. We've seen a difference on our campus with response to people who've had COVID and what has happened to them. Even in residential living, we've seen this.
Yeah, that's right. And I think the other thing too is within our care facilities, I mean, we don't have our masks on right now because we're physically distanced in this room. But having said that, we wear masks in public areas, in residential living, in healthcare, et cetera. And so I think that really makes a difference too, because even when we did have a person that tested positive, there was no spread. And there was the frustration then that we still needed to shut down, and that has changed too, and we'll talk about that in just a moment. But that really shows, I do think masks make a difference. And so some people may want to continue that even post-COVID, whenever post-COVID is. But the fact of the matter is, I think that makes a difference. But we have been fortunate. So between the masks and the vaccines, we have been able to keep it at bay. And hopefully we can keep it at bay within the healthcare and personal care areas as well in a positive way. That's certainly, we're hopeful of that. There's no guarantees because there are some outbreaks at other facilities too right now.
Yeah, in our local area.
Exactly.
Yeah. Well, you alluded to this, but finally, at long last, we've got some revised guidance coming out from the state that is very encouraging for residents who are in the higher levels of care who are vaccinated.
Yeah, that's right. Because the frustration is that when we had one person test positive, whether it be a staff or resident, we needed to close down that unit for 14 days and go through our protocol testing. And that's a challenge. It's, you go through the first test and then the first protocol test and the second protocol test. And fortunately, we were finding that we did not have COVID positive residents or staff beyond that. That doesn't mean that will always be that way, but in those cases to date, that's been the case. And so it was frustrating that we couldn't then loosen it up. Well, we knew it would eventually come. We were hoping it would come soon, and it is now here that has changed. So we can, based on our testing, determine whether there is a spread, and that will determine whether we need to close down the facility. Having said that, they've also then tightened up the testing requirements. So that is more stringent. It used to be the 5% positivity threshold in the county. That is now combined with the infection rate per 100,000. And the numbers in that category for us have been more stringent. So right now, we are testing twice weekly in healthcare our unvaccinated staff, and once a week our unvaccinated staff within personal care. So the testing requirements have gone up, but the closing down and the quarantining of the facility has loosened up. And if you look at it that way, then it starts to make some sense too, that you want to catch those cases early so you test more, but you also want to make sure you don't have to shut down and negatively impact the emotional health and well-being of residents in personal care and healthcare. So I think that's the logic behind it, and certainly for us, it's a positive direction, because that was the hardest thing. One case meant a shutdown. Yeah. So it's good news to be at this place. And it also, though, means get your vaccine, staff, residents, and families, because we have a lot of families coming in, and a number of the cases, the assumption was, oh, it's the unvaccinated persons. No, it was a vaccinated person that had a breakthrough case. And no, it wasn't an unvaccinated employee that brought it in. It was a family member who brought it in. So there's so many variables. The biggest variable that we can control is getting the vaccine and wearing a mask.
Yeah, absolutely. And this is another, topic, this question of the guidance changes that we'll be sending out communication on early next week. So people who are in personal care, health care, memory care, families and residents can look forward to receiving more information about that. But it is important, I think, to note that the changes are for vaccinated people. And
yeah, that's a very good point.
It's in some ways, I'm so pleased that we're not going to have to shut down an entire area for 14 days. I think that's wonderful. But we do have a few people, very few people in those care areas who are not vaccinated. And for them, nothing changes. Yep. If someone tests positive, they have to quarantine for 14 days.
Yes, if they had an exposure. So we would do a review, and if they had an exposure, then they would have to quarantine. But if they, through the contact tracing, did not have exposure, then they wouldn't. But you're absolutely right, and it's a very good point to make, that for unvaccinated people, you're going to still have to quarantine. So yet another reason to get the vaccine as a resident, so you don't have to do that. Mm-hmm.
And it will be so wonderful not to have to shut everything down, because it is so disappointing for residents. And that, I think, in some ways segues nicely into a new research study that we are participating in with Drexel University on the question of resiliency. How did we all survive the last 18 months? It's a really interesting question. What makes somebody able to live through something like this?
Well, and the first answer I would say to that is I have no idea how we all did, because it has been a rough 18 months coming up on 2 years. But it's really, from my perspective, the support of colleagues, friends, family. We don't have a dog anymore, so I can't kick the dog when I go home. Not that I kicked the dog before either, but
you're going to get letters.
Yeah, that's right. Yeah, people are going to be after me now. But the point is, there's all different ways. But I think for me personally, one of the big ways is working together with people that you're in it together. Mm-hmm. You're equally committed. You're equally focused. and you know it's hard, but you're bonded together with those people because it has been a hard year, and people have been very resilient. And I don't think there's any one secret sauce to that, but people have been that in different ways and finding their ways to find that centeredness for themselves.
Well, and I said, how did we all survive this? But the fact of the matter is we didn't all survive this.
Yeah, that's right. That's exactly
right. And that's
right.
Another aspect, I think, to what has made this so difficult is losing friends and family.
Yeah, that is very, very, very true. Mm-hmm.
Well, closing thoughts? Look how speedy we're getting.
Yeah. Closing thoughts. Well, one of the closing thoughts I have, and maybe this is my closing thought, some of you out there in viewer land may have heard of a music group, a trio, actually, I guess they would be, two brothers and a sister. They're called a girl named Tom. They happen to hail from Archbold, Ohio, and are connected with Zion Mennonite Church out there. But the great thing is they were just recently on The Voice, and all four judges turned around, and they have amazing harmonies, and really seem to be great young people and siblings too, which is kind of cool. But after we saw them on The Voice, because we had heard they'd be on, and Kelly Clarkson was the one that actually is going to be their coach, and she was all excited, of course. And I guess I would say, I don't know that there's anything she doesn't get excited about as a side note. But anyway, they have really impressive harmonies, and they're just good, seem to be good, wholesome people. But I looked on YouTube and found one, and it was an arrangement of Psalm 23. And so both the connection to what is happening currently with them and kind of the rise in notoriety, if you will, but also the song, we want to put that on the video from YouTube, from I guess their channel or whatever it was, because this idea of the Lord is my shepherd, for me as I watched it, their harmonies kind of gave me goosebumps, to be frank about it, but also just the message. And we're talking about resiliency and those connections, and just knowing that we don't have to be in control of everything, right? We sometimes need to trust and say that because we have this higher being, that we can relax and have our needs met. Yep. And so it was to me, it was a wonderful song. And then the great connection to current events was kind of fun too. So we're going to put that on the video here at the end for people to enjoy. And hopefully Girl Named Tom goes places, and we're happy to promote him on this show as well.
I would love to hear the story about how they came up with that name.
Well, actually, I can tell you, because apparently when the sister was younger, they used to, for some reason, call her Tom. I believe that's what the explanation was. And so then when they needed a name for their group, that's where they came from.
That's what happens when you have two brothers, right?
Yeah, that's right. I don't know if it was because she was a tomboy or what, but anyway,
interesting.
They seem to be a great group of young people, and it was fun to watch.
Good. Well, hopefully people will enjoy that. So thanks for talking. Thank you for watching. Again, if you have questions, please feel free to email them to coronavirusquestions@livingbranches.org, and we'll see you in a future video.
The Lord is my shepherd, I shall not want. He makes me lie in green pastures, He leads me by the stream, restores my soul, restores my soul. He guides me down the paths of righteousness, and and it is all for his name's sake. And yeah, I walk through the valley of the shadow of death. I will fear no evil, for thou art with me, and thy rod and staff will surely comfort me. He prepares for me a table before me in the presence of my enemies. He anointeth my head with oil, my cup it overflows. Now surely goodness and mercy will follow all the days of my life, and I shall dwell in the house of my Lord forevermore. And I will fear no evil, for thou art with me, and thy rod and staff will surely comfort me when he comes for me.